Representative Anthony Brown is vice chair of the House Armed Services Committee, retired colonel in the United States Army Reserve. He,
Whoa.
in 2004, deployed to Iraq, where he earned a Bronze Star. He was lieutenant governor of Maryland. He went to Harvard College and Harvard Law School and is entirely overqualified for this show, but he still joins us now. Representative Anthony Brown. Wow, is that an impressive resume? Good morning, sir.
Well, hey, good morning, Stephanie. Great to be on the show with you, and hope you're staying safe out there on West Coast.
Thank you. Yeah, you too, back there on the East Coast. Well, Representative Brown, I was struck, of course, by your resume. Vice Chair of the House Armed Services Committee. You've served. You've won a Bronze Star. Do you have any earthly idea why the president is not fully invoking
Defense.
nationalizing the supply chain so that we don't have? I mean, I know you've tweeted about it, but can you explain what you said? That you tweeted the Trump administration must fully invoke the Defense Production Act to give every state what they need. It does not seem complicated, is it?
Yeah, no, it's not complicated. It's a tool that was created back in the late '50s in the Eisenhower administration, and it gives the federal government an opportunity to say, hey, we've got critical shortages in certain supplies and materials, so we're going to sort of control on this during this emergency period only, the production and the distribution. When I speak to mayors, I speak to hospital systems and nursing homes, and a host of other people who need these critical supplies and devices during this pandemic. We need a federally coordinated, a federally directed program to produce and distribute these materials during this pandemic. And every day you hear the president talking about how, it's working seamlessly. That's not the ground truth, with so many people that need this equipment.
And Representative, obviously the story out today, 90% of the federal protective equipment stockpile has been depleted. The Health and Human Services Department say they have made, quote unquote, their final shipments of respirators, surgical face masks, face shields, gowns, and gloves, according to new documents. The remaining 10% will be reserved for federal workers, will not be sent to the states. The documents show only 11.7 million N95 respirator masks and 7,920 ventilators have been distributed across the entire nation. Both amounts, small fractions of the estimated amount of protective equipment needed by frontline workers. Again, everything they say in these press conferences turns out to be untrue, Representative, and it is so disturbing during this pandemic, isn't it? That he seemed to brag about that we've done 2 million tests. We were promised 80-something million, weren't we, by March? And
Yes.
Yeah, go ahead. Sorry.
So whether you agree with the president or not on the Defense Production Act, it's clear that we didn't mobilize soon enough, right? And documents are already emerging that show that as early as January, if not even before then, certainly the intelligence community saw this pandemic coming. The president started getting it in his daily briefs. So even if you're going to rely on the private sector to produce, whether it's test kits and the necessary resources at the labs, or whether it's the PPE or ventilators, you've got to start that mobilization process. We should have back January, February, and it wasn't until mid to late March that the president even started to acknowledge that we had these shortages. So it's a failure. If you look at the paper and the plans, we understand how to take on and address a pandemic. We've documented it. We used to rehearse it under the Obama administration. The Trump administration dismantled the programs, the activities, the offices, the personnel that are responsible for this. So we have an understanding. We just didn't have a will from the Trump administration to lean into this and do what needs to be done.
Well, and the other thing, Representative Brown from the Department of Health and Human Services said the Trump administration did not distribute supplies from the National Strategic Stockpile to states based on their individual needs during the pandemic, which we sort of knew based on him always saying the quiet part out loud about which governors he likes and which governors he doesn't and which governors he's going to talk to. And I mean, it is hard to imagine a more chaotic, ridiculous system during the biggest health crisis of our lives, isn't it?
Yeah, it certainly once again illustrates that this president is more focused on sort of personality politics. Do I like you? Do I get along with you? Do you shower praise on me every opportunity you have to speak? And if you fall into that category, then you may receive support from the federal government. But even that's not reliable because we've seen, the modus operandi of this president is, it's what have you done for me lately? And if you're not speaking favorably of him every day, then you run the risk of being cut off by the federal government. So a number of us have introduced bills. Alyssa Slotkin has a bill in. I'm introducing, if we haven't already filed it, a bill that that sort of tightens up the Defense Production Act, requires the president to be more assertive. This is true whether it's Trump or any other president, to more aggressively, robustly use the Defense Production Act, get it produced, identify where the needs are, and make distribution by need and not by personal relationships.
Can we talk about testing for a moment? Because Trump yesterday said we don't need mass testing. So obviously a lot of healthcare workers can't get it. I don't know if you heard Lawrence O'Donnell last night saying, I can't get tested. I was on 5 flights in March. A TV executive producer I know can't get tested. We know that less than 1% of us have been tested. I just can't understand how we're going to open everything back up again without knowing who's right, asymptomatic, pre-symptomatic, you name it. He basically just said we don't need it. And every expert I'm listening to said that's exactly what we need, or we're going to open up too soon and we're going to have a bigger wave, as has already happened in other countries, right?
Sure, and I'm listening to the same public health experts that you're listening to, no doubt. And if you listen to and rely on them, then you reject President Trump's notion that we don't have to test or ramp up testing. In fact, he's talking about defunding, federal defunding of test sites. Look, we should look at opening up the economy based on what public health experts tell us is safe and doable. And in order for us to do that, they're saying you've got to be able to test. You need to know where the hotspots are. You need to be able to use testing to anticipate the hotspot. So if you really are committed to opening the economy, you know where you can open it and where you shouldn't. Or even when you open it, you can detect where, hey, we see early signs, we may need to impose greater restrictions. So I don't understand how the president can push for opening the economy, yet retreat from the kind of testing you need to ensure that we do it responsibly.
Well, Governor Cuomo tweeted yesterday, the 1918 Spanish flu hit in 3 waves. We're only in the first wave. We can't assume that because we're seeing some positive signs, this will be over soon, or the additional waves won't hit. New York State will not underestimate this enemy. And again, we've seen this in other countries that opened up too soon. Are you concerned about that? That clearly he only seems to be concerned about the economy and his reelection, and it is just once again going to risk, hundreds of thousands of lives likely.
Yeah, and not only so we're in the first wave. We have not seen the peak in this first wave in most of the country, and given the sort of like the mobility within the United States, the chances of that second, third, and subsequent waves is even greater. We don't put restrictions on travel between one cluster community that experiences a hotspot and another part of this country. So we have a long ways to go. And as I've said in every virtual town hall I've participated in, as I'm encouraging the social distancing and the appropriate hand hygiene, in the absence of a vaccine, social distancing is our best medicine.
Yeah.
So
it's the only medicine right now.
It's the only medicine.
Yeah.
That's right.
Yeah. Representative, you also have tweeted, of course, about, you said Black Americans are bearing the full brunt of COVID-19 with higher rates of infection and death. Black Americans are more likely to be uninsured, more likely to have frontline jobs during this crisis, higher risk of asthma, heart disease, diabetes, hypertension. But you made a good point. Sorry, Madonna. The virus is not the great leveler. The consequences are not borne equally by all. We know communities of color are more likely to catch this disease because of their exposure and inaction to address deep health inequities. So, and as usual, as you also say, marginalized and vulnerable populations need more testing and doctors in our communities and more resources. So, you've been speaking out about that a lot. Thank you.
Yeah, well, this is something that I, along with my colleagues in the Congressional Black Caucus, have been focusing on. I've been working on health disparities for quite some time. As Lieutenant Governor of Maryland, we created this long-term strategy to address health disparities. And I think the disparities you're seeing, the disproportionate burden, if you will, of the coronavirus infection and deaths in the African American community, I think really reveal, it exposes the underlying health disparities, chronic diseases and illnesses that are experienced in the African American community. So short term, we need to do testing and outreach and certainly report on the data so we understand the impact on communities of color. But long term, we have to address these health disparities. We have to get more health resources into communities of color. And let me also add, Stephanie, that look, the coronavirus pandemic has sort of exposed so many disparities that fall along racial lines in our society, in our economy, in our schools, for example. There are many communities of color that can't do that distance learning. In our jails, where we're exposing inmates to this virus infection and death, you have a disproportionate number of African Americans in the criminal justice system. So, sure, we have to focus short term. What do we do to get beyond this pandemic? But long term, we've got to address these structural inequities.
Representative, can I say one thing? All of my listeners say, please hang in there on vote by mail. I know that you guys are fighting a tough fight, but Ari Berman, one of the experts, says news stories should stop saying Trump opposes vote by mail. He and practically his entire cabinet voted by mail. The Republicans want to send a ballot to everyone over 65. They only oppose mail voting when Democrats do it. And so, because obviously this election, our life does depend on it. Many of our lives, right?
Absolutely. We postponed our primaries from April 28th in Maryland to June 2nd. We do have a special election on April 28th. We're going to, for the first time, do 100% vote by mail. Now, we don't have in place the kind of the safeguards that you do in California and other states with more experience, but it's a good opportunity for us to really aggressively move in that direction.
Yeah. And thank you, by the way, for your tweet. You said on behalf of the people of Maryland, I want to thank California governor for sending ventilators to our state and continue to build up medical capacity. This virus does not recognize state borders. Only together as a country will we beat coronavirus. So, I have to love that, where the states have stepped in this giant void of leadership where the federal government should be. So, you're welcome, and thank you for your.
Let me just add this, Stephanie. We're grateful that California sent them to Maryland. I hope California is grateful that Maryland sent Speaker Nancy Pelosi to you guys.
Well played, sir. Well played. Nicely parried. What a thrill to meet you, Representative Anthony Brown of the great state of Maryland. Thanks so much. Hope you'll come back.
Thank you. Stay safe.
All right, you too. Bye-bye.